Tonight's program, this is the COVID update. We have two very experienced people at this point participating with us, one from Volusia County, one from the health department. The topic, as we're approaching it, is going to be to try to figure out sort of where we are in the continuum of the COVID experience. Where are we in terms of recovery on the road to normal, and what can we expect in the coming year? Our guests this evening, we have from Volusia County Public Protection, Randa Matusiak, who started her career with Volusia County as an administrative service manager for research at the Division of Corrections. She's now a special projects coordinator for the Department of Public Protection. And in her current role, she's responsible for data analysis projects and other duties related to operations and evaluation of the divisions in public protection. Since the pandemic began, she's also been responsible for providing updates to county management and the county council. And she is currently assisting the Division of Emergency Management in their partnership with the Department of Health. We also have with us tonight Ethan Johnson. Ethan is presently serving as the Planning and Performance Management Manager and Interim Communications Manager for the Department of Health in Volusia County. He received a bachelor's degree from UCF, Go Knights, in Health Services Administration, and a Master of Public Health in Health Promotion and Behavior from Georgia State University. While in Georgia, he worked with several Atlanta-based public health organizations as a program evaluator and research assistant. Over the past 7 years, he's worked with a variety of programs at the Department of Health. These include public health communications, tobacco prevention, environmental health, biostatistics, quality improvement, strategic planning, and workforce development. Ethan assumed the role of Planning and Performance Manager in October of 2019. In addition to his work at the Health Department, he is an adjunct professor at Bethune-Cookman University. So thank you to both of our speakers this evening. I will ask, I think, Randa to start us off first. I believe she has a PowerPoint she's working with.
Marianne,
yes,
we talked through this earlier, and I believe Ethan is going to start. Is that not what you all decided?
I would leave it completely to our speaker's discretion. If they have a preference on who starts first, that's fine with me.
I think we were thinking Ethan could kind of set up the issue as it is, and then I could kind of follow up with the response from Volusia.
Fantastic, thank you.
All right, thank you for having me here tonight, and thanks, Randa. As Randa said, I'm gonna try to focus mostly on the science, the vaccination, and kind of the overall story of COVID here. And then I will leave all of the logistics and the local response to Randa and the county. So from the onset of the event, the first case, which was March 6, 2020, through yesterday, March 22nd, there have been 36,887 COVID-19 cases in Volusia. And of these cases, 1,899 have been hospitalized and 697 have died. 2,494 of these cases, which is 7% of all of the cases, represent long-term care facility staff or residents, and 549 cases, which is 2% of all the cases, represent correctional facility residents or staff. In terms of vaccinations, statewide, a little over 5 million people or 5 million doses have been administered. 2,200,000 first doses, and then 2,700,000 series complete. So when we say series complete, That includes those who've received that second dose of Moderna or Pfizer, as well as the Johnson & Johnson. Since it's only one dose, it's considered series complete. And then here in Volusia County, we've had 127,327 doses have been administered, 50,875 first doses, and 76,452 series complete. So what that means is about 65% of Volusia County residents that are 65 and older have been vaccinated at this point. And about 23% of Volusia County's overall population has been vaccinated. Randa will probably get into this, the particulars of this, but as most of you all probably know, per the governor's executive order that went into effect yesterday, those 50 residents 50 years of age and older have now been included in the population that we're now vaccinating. And there's several other, with the exception of the large scale events we're doing, there's some special missions that have been done. And really, you all have probably seen this in the data, have heard this in the news, maybe even have questions about this in regards to barriers to accessing the vaccine within hard to reach communities. So that's part of the effort that we're doing in conjunction with the county. It's going into communities outside of our larger vaccination events, as well as specific events for first responders and K through 12 employees. So that just started at the end of January. And with those events in particular, there's been around 2,700 vaccines administered. And the homebound program, which I won't get into the particulars because Randa will, but there's been about 114 vaccines administered through that program. Additionally, the federal retail pharmacy program exists. We have about 25 pharmacy locations, I believe, Publix, CVS, and Winn-Dixie, and they are vaccinating populations outside of the populations in our executive order. Another point that I would make is the variant. So far in Volusia County, there have been 8 variant cases reported. For the state, there's been 1,075 variant cases. The variant, all 8 cases of the variant in Volusia County have been the B.1.1.7, which is commonly known as the UK variant. And at least 2 of these cases belong to the same household. There may be more in that. I haven't had a chance to look at all of them, but I know that the most recent 2 belong to the same household. So this UK variant is one of the 3 variants, South African and the Brazilian, that seem to be spreading more easily and quickly than the other variants, which of course may lead to more cases of COVID. But so far, most of the studies suggest that antibodies generated by the vaccines that are currently authorized for use in the United States recognize these variants, so they're effective against them. Anything else I want to say? Okay, so another point that Marianne wanted me to cover was like what happens after being vaccinated. So I'll go through what the most recent recommendations are post-vaccination, and then I'll give a kind of a brief explanation why. So after you've been fully vaccinated, which fully vaccinated for the Johnson & Johnson would be 2 weeks after your one and only dose of that, and then fully vaccinated after Moderna or Pfizer would be 2 weeks after your second dose. So after being fully vaccinated, you can gather indoors with fully vaccinated people without wearing a mask. You can gather indoors with unvaccinated people from another household, from one other household without a mask, unless one of those people or someone who lives with you is at an increased risk for COVID. So an example of that would be like visiting relatives who all live together. If you've been around someone who has COVID-19, you don't have to stay away from others in quarantine or get tested if you've been vaccinated, unless you are symptomatic. then you will want to get vaccinated and you would be quarantined still. You should still take steps to protect yourself and others where in situations like where you're unable to social distance, like being in public or being in a heavily populated area by unvaccinated people, and visiting with unvaccinated people from multiple households. And of course, that includes things like wearing a mask, staying 6 feet apart, and avoiding poorly ventilated spaces. Things you should still do is avoid medium to large size gatherings, delay domestic or international travel. But if you do travel, it's recommended that you still follow those mitigation guidelines. You should watch out for COVID-19 symptoms still, especially if you've been around someone who is sick, and still follow guidance at your workplace. So lately, there's been a lot of questions regarding the mask wearing and a little confusion around it because it's like, I'm fully vaccinated. Why do I need to wear a mask still? So the first thing is the goal is to continue wearing a mask until the population reaches herd immunity, which everyone always talks about. And the basic premise of herd immunity is when a sufficient percentage of the population becomes immune to the disease, be it by being naturally exposed or by vaccination. So we wear a mask. We wear a mask because, like, after you're vaccinated, your risk of being severely ill or dying from the virus diminishes almost down to zero. But there's still a small risk of you carrying the virus and exposing others. So that's the reason why we still wear the mask until that level of herd immunity is reached. There's been many different predictions for when that happens. If you watch the news, there's, depending on what channel you're watching and what physician or epidemiologist is talking, they have a different forecasted prediction. So it's not clear how long that will be. But one thing that is like agreed upon is the closer people are able to stick to the mitigation strategies still while we continue to vaccinate the population, then the shorter this period of mask wearing will be. But if we prematurely lax those mitigation strategies, then that extends the period of time before we actually reach that level of herd immunity needed for COVID-19 to be more like maybe the flu and less, deadly. Also, in terms of testing, that was another question that was asked beforehand. Testing is still important. It's still a thing. Of course, we've seen testing go down a little bit, and I'll talk about the positivity rate in a minute. But people who have COVID-19 symptoms should still get tested. People who have come into close contact with someone who is a confirmed positive should also get tested. Close contact is within 6 feet for a total of 15 minutes within a 24-hour period. That would make you a close contact. Of course, that excludes people who are fully vaccinated and who are not symptomatic, or people who have tested positive for COVID-19 within the past 3 months and recovered. Don't need to get tested following the exposure. People who have taken part in activities that put them at a higher risk for COVID because they can't physically distance or avoid exposure, such as travel or attending large social events. And people who have been asked or referred to get tested by their healthcare provider or state, local epidemiologist. The last thing that I was going to cover was our positivity rate. So one thing that I did want to share, and I'm sorry I don't have a visual or PowerPoint for you all tonight, but we do know that the vaccine is working within the population, and I have a couple graphs. This represents the state data, and I'll zoom in because it's a little small. Can you all see my screen here?
Yes.
Okay. So I'll explain what these, so basically This blue line represents the 7-day average of cases, and these orange lines represent people receiving the first dose of the vaccine. So what we can see is this particular graphs people younger than 65 and older, or people younger than 65. You can see with the blue line, the cases have trended down as the people vaccinated have trended up. So which is indicative of vaccination working. This up here is the same. This is for people 65 and older. You see the 7-day average case trending down as vaccination trends up. Of course, the vaccination level is much higher because this is where we started. Let's see. And the same trend can be seen when we look at hospitalizations, which is this line. This is the 7-day, the red line is the 7-day average hospitalized cases, and the same thing, people vaccinated, same thing. And then you also see it, which is the most important indicator here, with the 7-day average deaths. And we see the deaths coming down as people have been vaccinated. And the other thing that I would say is the present 14-day positivity rate in Volusia is 6.32%. So on average, every 14 days, out of all those that get tested, 6.32% of them come back positive. This is a great thing. This number has fallen significantly, considering back in January, this number was at like 11.5%. So it's come down significantly. However, it is important to note that in the beginning of March, it was down to 5.7%. And now we're at 6.32. So that's an increase. And there's, I would be just hypothesizing if I had to say why that increase has happened over the last few weeks. This number does fluctuate, so it's not anything to be alarmed about. And it also may not be anything at all. It may not be a statistically significant occurrence, but it is kind of a reminder, again, as we mentioned earlier, that we still need to remember to continue our compliance with these public health mitigation strategies, such as continuing to get vaccinated, continuing to social or physical distance, use masks, wash your hands, isolate and quarantine when appropriate. And this will all continue to come together. But I think the story is we're moving in the right direction rapidly. And as vaccines have become more and more available, we see improvements in pretty much every area that we want to see improvements. The caution is for us not to prematurely celebrate and, rip the mask off and start having large group celebrations and all of that, because we're almost there, right? So that is all I have for you all. I don't know, Marianne, if you want Randa to start right away, if you all have questions for me now. I think, yeah.
Yeah, I've got a couple of questions, Ethan. That was fantastic. Really informative. What happens for folks who don't get that second dose?
So there's a lot of there's a lot of research out there now that's being done. There is some evidence that suggests even one dose is better than having no dose at all, that it still has an impact in reducing your risk, although these vaccines, Moderna and Pfizer, were designed to be 2-dose vaccines. So it is imperative that that second dose happens. I know that we have had a lot of, and it's hard for us to quantify because of just low staffing and everything going on. We've had a lot of no-shows, for appointments, but the other part of that too is just because someone doesn't show up for our appointment, they may have gotten vaccinated at CVS and then without,
Gotcha.
So we're doing our best to follow up with those.
Okay, interesting. And I think I saw a question come up. Is there an issue of exposure when you're with children who are not vaccinated now and may not be for a while?
Well, if you're vaccinated, then no. So the idea behind how everything is working now is that the risk in children is significantly lower than it is in adults. So the idea is that herd immunity can be achieved without children being vaccinated. Hopefully, we're moving in the direction where children will eventually be able to receive the vaccine, and there's clinical trials going on now for that. But herd immunity can be achieved and protecting the population be achieved without children being vaccinated. But that does require a significantly higher percentage of adults to be vaccinated.
Is herd immunity measured by the rate of infection? How do you know you've reached herd immunity?
So I would have to get back to you with exactly how we would calculate that. But I know that generally speaking, that would be to the point where the virus is no longer a threat. When you look at, I'm trying to think of a good example. That I have a good example, but it still wouldn't answer your question. So to give you an exact response, I'd have to get back with you.
Yeah, I mean, I'm thinking in terms of we're all familiar, especially in this age group, with flu.
Right.
And so the flu still occurs every year. So it's an ongoing thing. And I guess we're not quite sure yet whether COVID vaccination is going to be along those lines, that there might have to be recurring vaccinations. Once we have, go ahead.
Mean, it's a really good, influenza is a really good example, because when you look at the number one cause of death 75 years ago, beginning early 1900s, is influenza, and then it was pneumonia. But influenza in particular, once vaccination was developed eventually, even though it is an annual vaccine that we get, it's generally speaking, it's not deadly, and it's not as infectious. So the hope would be for COVID to be something like that.
Okay.
But flu is a good example of that, because we know that things look much different prior to the flu vaccine.
In the beginning, you had mentioned, we were having populations affected at assisted living facilities and correctional facilities. Has that changed? Is that group, have they also not become as high a source as they were? I mean, I guess I'm just looking over time.
Yes. I can get you what those exact numbers are. I don't have them in front of me, but we have seen a decrease in long-term care facilities, as well as correctional facilities. Although, and Randa probably could answer this better than me, I don't believe though staff that work in correctional facilities have not been prioritized if they do not fall within the executive order. They haven't been yet.
Okay. Well, thank you. Thank you. That was excellent. Randa, can we move to you now?
Sure, happy to. I'm going to go ahead and share my screen then. All right, so you should be able to share or see my screen now. Okay, so thank you so much for that introduction, and I'm glad actually that Ethan was able to go first, because I do think it makes sense to go ahead and lay a foundation of what the kind of situation was that we as a county were facing starting in March, because I mean we were all it seems strange to think back to last March and think about how differently we looked at things and how differently we approached the problem of COVID, at the beginning of March 2020 versus now. And so I just wanted to kind of share a few things. First, some just logistics and some information on where you can register to get vaccinated, where those vaccination sites are if you're interested in receiving one, and then kind of how we've approached information sharing and getting things out in the county. So initially, our updates that we do, and this is provided to management staff on a regular basis, is just kind of a basic, where are we in terms of case trends? What do the total cases look like? How many deaths are we looking at? How many new cases or new deaths have we seen in the past couple of weeks. And now currently we're looking at the total number of vaccinated people. So we do kind of keep an eye on what that trend is doing, and that dotted red line is the a moving average over 5 periods. So we can see how it kind of fluctuates and ebbs and flows. And this type of information is the type of information then also that's been provided to County Council really at every meeting. It seems like since I think I started these probably last March or April. And so they have been kept informed as well on the trends as we've moved forward. And so we do keep an eye on this. We continue to keep an eye on this to see really, especially from a public protection standpoint, what our first responders might need to start thinking about, or what they can anticipate, kind of down the road. We're glad to see these case numbers falling. So that is wonderful. But to Ethan's point, very frequently when I present these in front of County Council, the message does remain that we are not out of it yet. These are still some, these case numbers are still much higher than they were last March. And so we do need to kind of maintain some vigilance in maintaining those social distancing and hygiene practices. So just to give you a little bit of some information then on what we can do about this on a personal level is first get vaccinated. So as Ethan mentioned, the executive order was updated, or a new executive order was issued effective on Monday. So, and this is anyone, so Florida residents are eligible to be vaccinated in the state of Florida. So these are residents who are 50 years of age and older, residents and staff of long-term care facilities, as you mentioned, healthcare providers with direct patient contact, and then persons deemed to be extremely vulnerable by a physician. And just from the perspective of somebody who's been out at the sites, I'll give you a little bit of information on where people get tripped up a little bit. We have a lot of snowbirds here in Florida, and so there is some confusion on, well, if I'm just down here for right now, or if I have a 3 or 4 month lease, is that okay? Can I come and get vaccinated? And there is a full laundry list of items that you can bring to prove a lease term, or if you have utilities in your name, or mail is sent to you at a Florida address. We can see that, and we can take a look at that if you come, or if you know somebody that you want to send to get vaccinated. If they just have that kind of proof of even longer term, residency, they can use that to go ahead and get vaccinated. So if they have like a Michigan driver's license, we can use that. Also, something else to highlight here is persons determined to be extremely vulnerable by a physician. So we can kind of look at that as anybody then less than 65. And a couple caveats to that is that there are then requirements for the vaccines themselves, because they've only been tested on certain groups, right? So those who are 18 and older qualify for the Moderna vaccine, which is the vaccine that we have been providing at the Volusia County Fairgrounds in cooperation then with the Department of Health. And then I believe, and Ethan, correct me if I'm wrong here, I think it's 16 and older for the Pfizer vaccine. So anybody 16 and older for that one. So we do have to pay attention to what the actual eligibility requirements are for the vaccine itself. But as far as state eligibility requirements are concerned, as long as you can receive the vaccine and that it's been approved for your age group, those extremely deemed or determined to be extremely vulnerable by a physician can be any age. Now, the thing to remember here too, and this is again just coming from dealing with people who are checking in at the vaccination site, is that you have to have a physician's form filled out and provide that at the vaccination site to be qualified in that category there. So if somebody was to show up to the vaccination site, for instance, and say, ooh, I have a really bad case of asthma and I've had it for years and years, that would probably qualify them, but we can't make that determination at the vaccination site. And frankly, certainly not the people doing check-in who are really county employees and are not nurses in any way, shape, or form. So that form is necessary. And I'm going to give you some resources here in a second where you can find that kind of information as well. Also, if you happen to know somebody that would fall under this category, they should be able to reach out to their doctors. That form has been distributed to physicians around the state, and they should be able to have access to that form there as well. But they do have to produce it, and then the health department does collect that at the vaccination site. So that's who's eligible right now for the vaccine in the state of Florida. Another little thing to mention there is that some other counties have expanded that kind of on their own, but we are following the executive order that's been, that went into effect as of Monday at the Volusia County Fairgrounds. So these are just a few of the sites that are available in Volusia County. So we do again have the Volusia County Fairgrounds. That is what the Department of Health is manning and operating and managing out there. And again, that is the Moderna vaccine there. The county Department of Public Protection and Division of Emergency Management actually are assisting in that effort. And so we are really there to support. We have helped with the prior to the state registration site, we helped with any kind of scheduling or appointment setting, or we used the Eventbrite ticketing system to be able to schedule appointments. We've since transitioned to a statewide registration site, and that's how people are then scheduled for appointments there. Publix throughout the county has vaccines available. Winn-Dixie, CVS, and Walmart, all of these other places are, have vaccines, and they do release them on a regular schedule here. So I've provided here, and I'm happy to share this PowerPoint with y'all at the end of this. It does have links in here if you're looking to schedule an appointment, or you know people who are looking to schedule an appointment. These are links that you can go to and use where Publix is scheduling their vaccines, or CVS is scheduling theirs, and so on and so forth. The easiest way to go about getting signed up for a vaccination appointment, however, is through myvaccine.fl.gov. And that is the state registration site. And so what you'll do at that site is actually you'll, if you're eligible, if you're not eligible, you just kind of sign up for some notifications to kind of keep informed about what the eligibility requirements are. But at that state pre-registration site, if you're eligible to receive a vaccine, then you can get in line at this site. So you'll fill out some forms. It'll ask you some questions about how you might qualify, what's your date of birth, what occupational categories might you fall into, and that then secures your place in line for Volusia County. So when sites are set up in Volusia, so we have the county fairgrounds. There was another site that popped up in another neighborhood that was kind of outside of the realm or scope of what the county and Department of Health set up, but they drew then from this. You might hear it referred to as share care as well, but this is the state pre-registration site, and that basically just reserves a spot in line, and you really just wait to be contacted then from the people that manage this, manage that system. So they'll either call, or you might get a text or an email then to go ahead and schedule your appointment. Something that we do want to make sure people are aware of, though, at this point is that, not at this point, but at all points, you will not be asked for payment information at any time when you're scheduling an appointment. You will not be asked for a social security number at any time when you're scheduling an appointment. If you are asked for that information, hang up immediately. And you could even go as far as reporting that to law enforcement, because that is likely a scam. You are not going to be asked for that level of personal information to sign up for these for the state pre-registration site, and you should not be asked for payment information as well. But again, I'm happy to share these or jot these down real quick. Also, if you just really for all of the others, Publix, CVS, Walmart, Winn-Dixie, if you're familiar with Google, if you just Google Publix COVID vaccine, it'll take you right to this spot, and you can sign up and see when they have available appointments as well. But that state pre-registration site, again, you don't have to keep going on and finding appointments and seeing, and sitting at your computer all the time. You can just sign up, get in the waiting line, and then they'll call you when appointments become available. As far as some of the things revolving around reopening. So, so the question is, and Ethan was, I think hit the nail on the head when it comes to, mask wearing and when can we stop wearing masks if we're all vaccinated and all that kind of stuff. And I think it's a good point. I learned early on in this whole ordeal that, looking to projections and looking to estimates is just kind of, you think you got it one time and then next week they're updated to something else, and it just becomes really frustrating to have to explain to people and all of that kind of stuff. So really, we'll get there. Just, be patient. We're getting the vaccines out. We're getting those vaccines out as quickly as possible. I mean, if you think that, at the beginning of January, when the vaccines were just kind of trickling out, from January to now, we have over 120,000 people in the county of Volusia vaccinated. That's a pretty big number. And so that is just going to keep growing. And so we just have to stay patient as much as we can and maintain those, masking and other protective measures, in the meantime. And those are the things that are going to help us be able to kind of reopen. So if you recall, Governor DeSantis actually started his reopening phase very early. So it seems strange to think about it now because a couple of weeks ago, Texas was kind of in the news because they just lifted their mask mandate and they're reopening and all of that kind of stuff. And really, Florida has been in that mode for better, good or bad, however you agree with it. But Florida has been in a reopening phase since May of 2020. And so we haven't gone back into any kind of a lockdown phase or anything like that. Now the reopening was phased and it was slow, and we started kind of planning for it much, a little bit later because it was, again, a slow phased reopening plan. But there is a reopening plan called Relaunch Volusia that's available through volusia.org. It's actually got a link on the front page for that information. And that kind of gives a little bit of background on, what the thinking was in the county for relaunching and reopening. But ultimately, we're guided by the decisions of Governor DeSantis and his executive order. And so currently, there's little room to be able to put many restrictions or limitations on restaurants or bars and all of that kind of stuff. And I think just recently he lifted any kind of fines or fees that were levied for mask violations or anything like that might have happened as well. So really what we're doing as a county and what we did during, or what the county did during Bike Week, for instance, just recently, was try as hard as we can to get that public messaging out to keep it up, Volusia, to wash up, back up, and mask up. Really to keep those good habits in mind. And so I know we've seen pictures of Bike Week, and we do just have to appeal really to personal responsibility in this sense. And so personal responsibility, again, to take those kind of precautionary measures. So when I know that there was some of those questions from Marianne in prepping for this is, what can it look like as we move forward? And Ethan mentioned, travel restrictions. The CDC puts out some guidelines for travel restrictions. It continues to be, don't travel unless you have to, but if you're going to, get tested before you go, get tested before you come back. If you're going to do any kind of traveling, particularly international traveling, you want to check and see what the restrictions are before you go. I think there are still a considerable number of countries that are restricting travel from the United States. So you want to see what those restrictions are before you go. And all of that information is available actually through the CDC's website. And I'll show you that here in just a second. And so other activities that we've been doing in the county, or that county agencies have been doing, is we continue again to push out, or continue efforts to push out those vaccines. Part of those efforts are, as Ethan mentioned, it's the large site at the fairgrounds. It's these what are referred to, or you might, if you're in the habit of listening to county council meetings, you might have heard of them as the minority mission. So those are sites that are set up specifically to serve the underserved communities. So I think I actually saw a question that popped up about, what is the race breakdown when it comes to vaccinations. And I'll show you actually a really good resource that you can look at, to kind of keep track of that on your own if you're interested in it. But those minority missions are meant to target underserved communities. And then, of course, then we do have those homebound missions as well that are intended to serve those people who cannot leave their home to be able to access a vaccine. And so we are working emergency management, the Department of Public Protection, and really all people across the county government are working to help out with this effort because we have staffed those sites, or we support that site with the CIC staff, so Citizens Information Center, which include staff from across the county. Staffing concerns to continue to be an issue, not as much or as heightened as they were at the very peak of COVID. But we have staff, we have to man essential jobs, and we have to be there to be able to provide these essential services. And COVID has impacted our staff just like it has, the rest of the world. And so we have to do our part in managing staffing expectations. And then also, we will continue to, push out funds as they become available if the federal government, passes these, relief packages, and as they trickle down into the community through county government. I'm sure that, I don't know if anything has come down yet through the most recent relief package, but that would go in front of council to decide on, how to go ahead and manage that. And so community assistance and economic development actually just presented some really good information at the last council meeting on the kind of assistance that they have already provided. They've spent over $9.3 million through economic development on small business grants. They've provided 7,000 PPE kits, so that helps those businesses from having to spend money on buying PPE. Community assistance has provided almost 2,000 tons of food to families throughout the community through their efforts. And then they've provided almost $25 million of rental and mortgage relief. And so those are the types of activities that the county has been involved in throughout the pandemic. And as that money comes out, then we'll address that as necessary. And then, of course, we continue to monitor those case trends and then respond as necessary if we need to. So I just wanted to kind of close this with a few really good sources of information and show you around the sites a little bit if I can. So the first, Ethan's familiar with this, I'm sure, because this is his territory, but the Department of Health has some really good information here. If you're ever curious about who is now, can you see this? Are you seeing a website on your screen? The Department of Health? Okay. So if you're curious about who is now eligible for vaccines, this is great because they are pretty good, are actually really good about updating it regularly. If you needed the physician's form, you can actually access it here as well. And then to the question about who has been vaccinated or what do the groups look like, there are a number of really good reports here that are updated on a daily basis. And this vaccine report is actually where I find most of the information that I report out on. So I'm going to give you a little bit of a behind the scenes where I'm getting all of this stuff. So if you go to Volusia County, it's on page 65, you can see the breakdown then of who has received vaccinations or vaccines in the county, who's on their first dose, who has their series complete, and then of course this breakdown by race and ethnicity, as well as gender and age group. So that's a really good source of information. In addition, we have the Agency for Healthcare Administration. This provides a dashboard here where you can kind of monitor, if you're interested in it, hospital capacity and current COVID hospitalizations. And I don't have any special permissions to get into these websites. These are all public websites and public sources of information. And that one is not wanting to cooperate with me today, maybe because it's on the same thing, but this provides, again, a really good dashboard for current hospital capacity and available bed space, and again, COVID hospitalizations. And then finally, I just wanted to kind of bring your attention also to the CDC COVID-19 website. This has all kinds of information. And if you're interested in any number of things like traveling and what the current guidance is for from the CDC. They have a lot of information here. Travel, if you're wanting to see, what would it be like being on a cruise? What's the mask requirement in any number of places? And there's a lot of links and really useful links here to find out what each state or locality that you might be going to is requiring as well. And so I just kind of, again, wanted to bring your attention to those really, really good sources of information. If you're interested in keeping an eye on kind of where the cases are going and how that's working out, those, and especially the Department of Health has really good up-to-date information on who's eligible for a vaccine and also where you can get one. So those are great. Again, I will share this presentation so you have access to those links so you don't have to write it all down really quick. And that's really all I have for now, unless there are any questions for me.
Yeah, I see a couple of questions coming up. I apologize, I can't see the chat room, but Ann, I think you had one.
I did.
Ann?
I did. I had one but Randa just showed us I was asking what was the percentage of minorities that were getting vaccinated. But I've just followed up with another question to ask, are you finding that there's resistance within the African American community, or is it lack of access, or because the numbers are staggering when you see, at least they appear to be staggering, the comparison of the number of white folks and Black folks that are getting vaccinated.
Right, and I'll let Ethan jump in on this too if you want, if you have any additional information here. I'm not familiar with any kind of outreach, in terms of surveying on perceptions and all of that kind of stuff that's been done for the African American or minority community in Volusia County specifically. But I do know that that's kind of the thought right now with research that's been done broadly, in vaccinations, is that there's a hesitation. There is some sort of hesitation. To counter that, we have tried to go through, those minority missions are actually held or hosted by churches in the community. And so we are hoping that that helps with the hesitation and to have some level of authority then in that community as well. That's helping to support that mission. So I have heard just in other research that there is a hesitancy. Sometimes we have in other minority communities, in the Latino community or Hispanic community, there are language barriers. And so we have had events up in Pearson where we've had, Spanish speaking nurses that are there, and able to help out with that. And so there's a number of different barriers that can come into play when it comes to those minority communities. Typically though, and the one that we really want to try to focus on as much as we can, I mean, it's all important, right? But certainly the access to the vaccine. And it's things that would limit access to medical care more broadly. Transportation, can people get to a vaccination site? Is it close? Is it scheduled at a time when people are able to go? And so there's a number of things like that that do come into play when systemic issues that come into play when it comes to reaching those minority communities. And so by going into the community, not making those groups come all the way out to the fairgrounds, by reaching them and going to them where they are, we're hoping to be able to address that even more. But certainly it's a struggle because it's a structural issue. It's a systemic issue for those communities specifically. Ethan, did you have anything to add from the Department of Health perspective?
Yeah, sure. Well, first of all, I agree 100% with everything Randa just stated. And I would add, it's interesting, in terms of the hesitancy conversation, the De Beaumont Foundation is doing an ongoing study on this, and they update this information. But the two most hesitant groups in the nation are Republican voters age 18 to 49 and Black Americans age 18 to 49. And they rank almost equal in terms of their hesitancy. And Volusia County votes predominantly Republican, and has a Black population that is specific to specific areas in our county. So I think once we get to a certain point with vaccination in our area, we're going to meet a wave of resistance that isn't from necessarily the African American community, but our community as a whole, because we really are at risk, I should say, for having a high percentage of people who are hesitant to be vaccinated once we actually get to that point. Right now, there's still people waiting in line to get vaccinated, right? So I think that we may have not really gotten to the point where we can measure that yet, but once we do get there, I think the hesitancy situation is a more broad situation versus, as Randa mentioned, the access situation is more the situation that can readily be addressed and needs to be addressed, that equity in the access of the vaccines.
Excellent. No, it's fascinating. I was looking at some data on Florida as a whole, and yeah, the disparity is stunning in terms of just looking at the comparison of numbers. Any other questions from the audience?
Someone also asked earlier, and I didn't realize I responded privately. Someone asked about the data that Randa and I reported on in terms of the numbers of vaccines. That is inclusive of all vaccinations in the state, regardless of whether the county and DOH administered them or it happened in a hospital or a pharmacy. That's everything.
Ethan, how is the supply controlled? I mean, how does it get doled out?
Allocated. That is controlled at the state office, and that's based on. I know that it's also based on need. So if we have vaccines that aren't being distributed or used, then the supply that we get next time will likely be impacted by that. I know that there are some counties in Florida that have not filled up appointments every week, and so I know that that's a part of it, but I couldn't speak to that specifically. I don't know if Randa knows more about that.
I'm sorry, I was trying to respond to a private message on here. What was the?
We were talking about vaccine allocation, and my response was mostly, well, it's based on population and need, and it's also based on the appointments. So if you have counties in areas that are not filling up all of their appointments, they're not going to be allocated the same amount of vaccines as they were before. They're going to go to areas that are using them. So that's the other thing that we're really trying to do here is every vaccine getting into an arm. Even when there's, I believe the Moderna, I think there's 6 doses in a Moderna vial, and after it's broken, has to be used within so much time. So if there's a first responder that happens to be there working that isn't vaccinated, there's been times when there's been a little lady in the parking lot that was confused about where to go, and we're like, actually, we have a vaccine dose, come inside. We've got a nurse to give it to her right there, because that's really the goal, is to use them all.
Yeah. And that's just to add that that pre-registration site or that wait list is so important, because I think that is helping guide and gauge what the interest and what the demand for vaccine is in a certain area. Certainly is based on population, certainly is based on need, but it's really interest as well. And so as much as people can get on that and pre-register and get on that wait list, the better, because we want to make sure that it's clear that there's demand, as much demand as there is in the county, for sure.
Marianne, there was a question that was submitted in the chat room. Is the vaccine one receives from any venue recorded in the health department vaccine record?
Yes, it'll all be in Florida Shots. It's all recorded.
Okay. Ethan, do you think there will come a time when that database becomes, I don't know, with all the discussion of vaccine passports,
Right.
someday am I going to have something on my phone that I can say, see, I've been, I voted, I'm vaccinated, that kind of thing.
I think that would be very convenient, but I think because of all of the issues with health information, I don't see that happening with the.
Good point.
Yeah.
Good point.
Mm-hmm.
Well, we're still probably going to have to carry something someday, much, I guess, like probably a social security card. But, well, thank you. Thank you so much for the time you put into this.
Miss Presley's raising her hand.
Marianne, I
Okay.
have a question, I guess, and a comment too. when we talk about access, I think that is really a major, major concern, because there are so many African Americans who have not been able to get to certain places to be vaccinated. And I just think that somehow or another, we need to look at, maybe churches or things in their community. Access is really a problem, and I don't think people realize how much of a problem it is. I was interested in you responding to the question that Ann asked about the ethnicity in terms of getting the vaccination. And when you put that information on the screen, I just, looking at the whites and compared to the blacks, I just could not believe what I saw. And so it really, in the Black community, we're going to have to do so much to help them and to find out why people are not being vaccinated. Is it because access is an issue? Is it because of things that happened years ago to Black people? Is that a concern with Black people? And if that is the concern, then who are the people who could help to allay their fears and their concerns? But it's just mind-blowing, that information that was on the screen. And I do think we really do have a major issue. And the other thing I think too is that, we say get on the computer, get on the computer, but so many people don't have the computer. So many people don't know how to get on. And that is a major issue for people.
Good point, Vicki. No, it's a good point, because we often tell people computers are at the library, and yet, I mean, a lot of those public facilities are themselves constrained to some degree. Do you think, maybe we need to look more at some mobile delivery systems that Randa mentioned in terms of getting to a community?
And on the websites that Randa gave, there are phone numbers that correspond that can either walk someone through it or do the registration process for them, get them on the homebound vaccination list. But it is getting that information to the people who need to receive that information is important. And I'll add this, yes, it's a high note in terms of the progress we're making with the vaccine, but I do want to mention, because what Ms. Presley said, the numbers that you see on that screen, the disparity is actually worse than what we see there, because what we don't see is the overrepresentation of Black and Hispanic residents in the cases, in the hospitalizations, and in the deaths.
Mm-hmm.
And without getting too technical, there's a statistical measurement where you do age adjusting. So we've done that, and I have an intern working on the project now, but when you look at age adjusted rates, which takes into account the populations within specific age groups, because we have, our population is, tilted more toward older adults than maybe other populations. So it makes these groups comparable. But when you age adjust and you look at age adjusted rates, the death rate, the hospitalization rate, the rate of severe complications right here in Volusia County for Black residents and for Hispanic residents, for Black residents, it's more than twice as high. So theoretically, if you're talking about equity, we don't want those numbers that we see in the vaccine, we don't want them to match the population, right? We want those to be closer to those impacted by the virus the most, right? So those numbers should be significantly higher, but that's like a whole nother level of a conversation that has to be had, right? But I do think that there are some initiatives. I know that Mayor Henry is really interested in engaging in this more, and I know that he's been in communication with the county, with emergency management, and they have a few ideas with having kind of community leaders be liaisons to kind of be the people that are communicating this message to the people in their churches, the people in their organizations. And from what I've read, the most impactful stories happen when people within the community get vaccinated and share their story. So both of my grandmothers are vaccinated, and neither one of them would have gotten the vaccine 4 months ago. So I got the vaccine and I told them, and I talked to them about it, right? So I think that's the most powerful message, especially in the African-American community, with that legacy of distrust for government and healthcare. And it's the same that could be said for low-income white Americans. The same can be said for Hispanic or immigrant populations. So all very important things to consider.
So Ethan, on that, from that respect, it's both the message and the delivery that has to be met at this point.
And there's some resources that we can share with you. Actually, it's also from the Davy Mott Foundation, and it's called Language That Works to Improve Vaccine Acceptance. So it's interesting because a lot of the language that I probably even used it while we were talking because it's so common, but it's actually language that discourages people from being vaccinated. They say using words like the consequences of not taking the vaccine, or talking about drug companies or historic anything. Those are bad words. Those turn people off, versus when you talk about safety, protecting your family, those are things that encourage people. So it gets very specific when you're trying to, get people to buy into it. And that's a lot of work. That's going to be a lot of work in our community once we get to that point. Mm-hmm. Right now, people are beating the doors down for vaccines still. So.
Okay. Well, thank you again for a fantastic